Yes, it will. Okay, cool. Okay, all right. So series 2, week 7, advocacy. Always like to start with definitions. In series 1, we did get into both advocacy and self-advocacy. So let's just very quickly review that from series 1 before we go a little bit deeper and do it a little bit differently in series 2. But what we are talking about is advocacy is when we speak up for our clients' needs and preferences, when the client is unable to do so for themselves because of their mental health symptoms. Self-advocacy, on the other hand, a little bit different. It is the client then being able to communicate, convey, negotiate, talk about their needs, their wants, their desires, and kind of assert their rights is another way to think about self-advocacy. So there is a difference. And please, in your documentation, be clear if you are the one doing the advocating or if your client is the one doing the advocacy for themselves and you are there supporting, because there's a difference. And if you want to be looking at progress, from session to session to session, it makes a difference if it's you're the one doing the advocacy or if it is the client that is advocating for themselves. So please just differentiate between the two in your documentation to be clear what skills it is that your client is using and to what degree are you providing support, so we can kind of see the progress from week to week. So before we can even advocate for our clients, before they may advocate for themselves, you may want to take it back a couple steps. Don't just run right towards self-advocacy. Let's take a couple steps back first to really understand what the problem is and what is even the desired outcome, because you kind of have to know where you're going before you can get there. So be real clear with what the end result is. What is the desired outcome from your client before we jump into any kind of advocacy or self-advocacy. So that being said, your client may benefit from further developing their problem-solving skills as they are working towards being a self-advocate or as they are working towards speaking up for what they want. They may want to really think about it in depth as far as what is the problem, what are potential solutions, what is the best way to go before they just start asking for things or demanding, their rights be honored. They may need to plan ahead. And that's really what problem solving is. It's thinking ahead, kind of cause and effect. If I do X, what's going to happen? What will be the effect on me? What would be the effect on others? So please, take some time to teach good problem solving skills and go through these steps with your client. So this is the first handout, 3.7.1. We're going to use this as a guide. So if you'd like to follow along on that actual handout and take notes, that would be fine. Or if you'd rather watch the PowerPoint, I'll refer back to the different steps as we go through the PowerPoint. So have 3.7.1 handy if you'd like to review that. But step 1, according to the handout, is to first define the problem. Your client may have a vague idea. They want to feel better. They want to get out of here. They want to be more independent, but that may be as far as they have thought. They may not be very clear, or they may be confused about where to go, who to talk to, where do I even start, to feel more independent, what do I need to do? So really writing out the problem, whether you write it out or whether the client writes it out, having it written down in writing where they can see it, oftentimes helps you and the client to organize that information, see it from different angles, brainstorm, identify what is the most important aspect of being independent. What is it about being independent that they're looking to achieve, or what part of being independent are they looking at? So definitely starting with defining the problem. And you can certainly support. There's lots of great questions that you can ask to help your client to narrow down what it is that they're trying to achieve. When and where does this problem occur? What are all of the potential problems, or excuse me, what are all of the potential causes for this particular problem? So this is really brainstorming, and there are really no wrong answers when it comes to the brainstorming phase. We want to look for as many potential causes as we possibly can, and then we can start to rule out what may actually be a contributing factor here as we go. But when you're brainstorming, you don't want to look at anything as being right or wrong. You just want to keep generating ideas, keep that list going, get as many as you possibly can. You also want to try to narrow it down and avoid vague problems like, I feel tired. Consider asking your client some of these clarifying questions like, well, when do you feel energized? When do you not feel tired? To kind of narrow down where they're experiencing this problem, when, what time of the day. Also normalize for the client that it may feel like they are always tired. They might say, I'm always tired. I'm tired from the minute I get up in the morning to the minute I go to bed. But once you support them to really think about it and break it down, they may be able to cite specifics of when and where they do not feel tired, or when they feel less tired, maybe how they explain it. So yes, you're engaging in brainstorming. Don't rule out any idea as being bad or good, wrong or right. You're just generating that list. Trying to be as comprehensive as possible as you're defining the problem. Try to be as clear as you possibly can. If there are many parts of the problem, which there sometimes are, support your client to describe each of those parts. If they find it difficult to separate emotions from their problem, a good tip is to ask your client to describe the problem from somebody on the outside. So maybe the perspective of a friend. How would your roommate describe this problem, for example, to help kind of get some distance and to kind of remove the emotion from the problem. Using that list that you just created in the previous slide of all of these potential causes, you're going to continue then to help your client, maybe by using an I statement. Remember in series 1, we used those I statements. I feel blank, when, because, where, due to, all of these different factors that you just identified, as a way to really kind of get to the root of what the issue is. So how they're feeling about the problem, as well as what the problem is. So now that you're clear on what the problem is, how they're feeling about it, step 2 is to come up with multiple solutions. Again, when we're brainstorming, there are no wrong or right answers. We just want as many as we can possibly come up with. I would say minimum 3 possible solutions to the problem. Without considering multiple solutions, people often get stuck on what worked or what didn't work in the past and are kind of stuck in the past and can't really move forward to the future. So this means that we may need to try a different approach. There are usually many solutions to one problem, and our first ideas are not always the best. So that's why we want to get as many as we possibly can here in step 2. So what you're doing here, again, is brainstorming, supporting your client to brainstorm. Get creative. You're going for the number of solutions or quantity, and we're going to filter out for quality and solutions that are feasible here in a second. So just create that list, as many as you possibly can for solutions, and then we will talk about which ones might actually work later on. So if your client's problem is, I feel tired all the time, or I'm always feeling tired, you are going to support your client to think outside the box, maybe when it comes to step 2, maybe saying things like, other clients I worked with when they're feeling very tired have talked to their doctor about daytime sleepiness, or, I have supported other clients to improve their sleep hygiene, their routine at bedtime, so they sleep better at night and feel more awake during the day. You can also say things like, can we look into what activities are going on after lunch, before dinner, that might be engaging and keep your attention, help you feel energized. So you can support by asking questions when it comes to the brainstorming phase. Also think about their environment. What could you change in their environment that may help them to feel more awake? Are all the lights off and the curtains are drawn? Could we have more light? Could we make things brighter in their environment to help them? So generating as many solutions as you possibly can is the idea here. In step 2. So I just want to pause here because I know I did mention multiple times that there are no quote unquote wrong answers when it comes to brainstorming. So I just wanted to see how you guys might respond if your client suggested as a solution to being, having trouble sleeping at night, to drinking a bottle of wine to help them sleep better before bed. What might be your reaction to that if they suggested that during step 2? You can either unmute and share, or you can go ahead and put it in the chat. Either way is fine. They're trying to sleep better. Their first solution is, I'm just going to drink a bottle of wine every night.
Maybe
Before I
instead
go.
of the whole bottle, you could just, let's maybe 1 or 2 glasses.
Okay, okay. So you would
I mean, I feel like the whole
try to
bottle is
talk them down.
jumping to the extreme of the spectrum, so
Okay,
that's pretty extreme, so.
okay. Okay, so you would maybe
Or
negotiate.
healthy, you know, obviously like better alternatives, healthier options, but I mean, a
Okay, so
whole bottle, pretty
you'd,
extreme.
you would negotiate, it sounds like, talk them down from that number. Other people in the chat, Andrew says, talk about consequences, you know, what would happen if you drank a bottle of wine before bed. Let's see, Kristen, I would ask them more questions about why they feel they need to drink the whole bottle of wine. Seneca, I would ask them to come up with a couple other steps before coming to wine for relaxation, or drinking 1 glass while listening to classical music. Okay, so, oh, hold on, I got this thing downloading on my screen. So it sounds like you guys are all, during step 2, hearing their suggestion of drinking a bottle of wine before going to bed, and then doing problem solving again. It sounds like you're doing problem solving about their solution. What do you think could happen if you shoot down or discount a client's solution as we're in this very early phase of developing multiple solutions? If you're just like, nope, that's not going to work, or nope, not a whole bottle of wine, 1 glass, or nope. What impact do you think that might have on the therapeutic relationship if you do it just immediately at step 2?
It can make them feel discouraged and unmotivated to offer up solutions.
Yeah, yeah, I could. I mean, I totally hear what you guys are saying. Like, I'm not suggesting that your client drinks a whole bottle of wine before bed. But yeah, like some people are saying here in the chat, it could affect rapport. It could, they could lose motivation for participation, might not want to discuss anything else, might not want to talk. Yes. So I know, I mean, I feel I'm right there with you. If I had a client and they suggested, oh, I'm just going to drink a bottle of wine before I go to bed, my internal reaction is, oh, not a good idea. You know, all those consequences, not good. You know, maybe a short-term solution to a long-term problem, like all of those things that you guys just said. But outwardly, I think in this early stage, it may have a negative impact on their suggestions of other solutions or wanting to like continue further the problem solving. So not easy to do. Don't get me wrong. I'm not trying to say it's easy to just write down all of these solutions no matter what. But I think it's important to the relationship to consider, at least consider all of them before we start ruling them out. Absolutely. So I know it's not easy, but resist that urge to, in the middle of problem solving, go into more problem solving. Right now we're brainstorming. So once you have gotten a nice big list, at least 3 solutions, now that you've considered all of their suggestions, as well as your suggestions or other people's suggestions as well, now is when we can start throwing out solutions that are obviously ineffective, not practical, unhealthy, by doing just kind of what Andrew was talking about. Let's talk about consequences. So, you know, now that we have this nice long list, now is the time to go through the pros and cons and let them give you the pros and cons. Let them tell you, you know, what is the pro of drinking a bottle of wine before bed? Yeah, I might fall asleep, but what is the con? I might feel hungover in the morning. It's not good for my heart. It's going to interact with my other medications. I upset my stomach. I may wake up in the middle of the night, even though I do fall asleep initially. So help them to come up with the pros and cons versus you telling them what the pros and cons are going to be. Again, not easy to do, but I think it's much more powerful when they generate not only the solutions, but then generate the pros and cons of each one that they're considering. That way it's their idea and not necessarily yours. You're just supporting them to solve the problem. So now that you have a couple remaining solutions, maybe you've eliminated drinking that bottle of wine, then now that you have just a few to look at, then you can go more in depth into each one of the ones that are left, because those are the best ones. This can be done again by examining strengths and weaknesses of each solution that has remained. I do want to point out that this may take several sessions. I'm not trying to tell you that you're going to solve your client's problem in 30 minutes, probably not. So this may be something that you start and come back to, and maybe come back to the brainstorming after a week or a couple of days in between. They may have thought of even more solutions, or maybe other people have suggested solutions. So encourage your clients to sleep on it. That's a great tip, to not try to solve a problem in 30 minutes or less. It's a step-by-step, it's a day-by-day process. So come back to it. Suggest your client even run their problem by other people, a trusted close friend, family members, other people on their support team, to get multiple perspectives of things that they may not have even considered, or that you may not have considered. So give them some time to think about it, give them some time to sleep on it, and then come back to it. Encourage them to hang on to that worksheet, add to it, or maybe you have a list going that they can add to it, if in between sessions they think of even more solutions that they want to consider. So as you're coming up with strengths and weaknesses, here are some great suggestions of questions to ask to determine, is this a good possible solution, or is this kind of a weak possible solution? You know, is this a short-term or a long-term solution? I think drinking a bottle of wine probably is a short-term solution. It might help you fall asleep today, but if you keep doing it, it is not going to be a long-term solution. It's not sustainable. How likely are they to follow through with the solution? They may have a great weight loss plan with diet and exercise, and it's very detailed, but are they likely to follow through with it? How reasonable, how realistic is that particular solution? And then how will the solution affect other people? I want them to consider, how will this decision affect others in their life? Do they need other support? Do they need to rely on other people to put the solution into place? Just taking into consideration other people and how that may affect them. Okay, so then we go on to another part of step 3, which is to assess the solutions and then choose one. So here I want to kind of put it back on you guys and talk about, how might your client decide what solutions to throw out and which to keep? And what is your role in that? How do you support them in that, identifying strengths and weaknesses, or identifying the pros and cons? So kind of two parts to this question. What do you see happening from your perspective, helping your client to choose a solution? You can either unmute and share, or you can put it in the chat. Either way is fine. Oh, I think we have something in the chat. Oh, no, just kidding. Anybody at this stage in problem solving, as we're trying to find one solution, how might you help them decide what to throw out, what to keep?
Can you repeat that? I'm sorry, I went to the restroom.
Yeah, no, that's okay. So when you get to step 3, you're kind of going through all of the solutions, looking at the strengths and weaknesses of each of them, pros and cons. How would you approach which ones to keep versus which ones to throw out? Like, what is your role in narrowing down that list?
We do a pros and cons list. I've done that
Sure.
before with clients. Some of them are not making the best decisions.
Absolutely.
But do like a pros and cons list, where like that, I don't know if you've ever seen like that bubble circle that goes like this. You got the inside of it. I've done that as well.
Okay. So an actual, like, another pros and cons list. Something else in the chat. Let's see. Yeah, is it achievable in a timely manner? Yeah. How long would it take to actually accomplish this? Are they willing to put in the work for that length of time? And if not, what could they do that might be quicker? How could they see results earlier? Okay, that's a great question to ask. Some more things in the chat. Make sure it's a measurable goal, to make sure they can meet the goal. Absolutely. Let them know we can help by starting, making sure they are starting to work on the goals. Okay, absolutely. So take inventory of if it is a achievable, measurable goal, and then how are you going to help support them through it? Okay. Yeah, so I think it was Seneca who mentioned pros and cons. Does anybody remember back to series 1, when we learned about stages of change, when we learned about the decisional balance matrix, which is another fancy pros and cons? What are the pros of changing? What are the cons of changing? What are the pros of staying the same, or staying in the same situation and not making any changes? What are the cons of staying in the situation and not making any changes? So you may want to use some motivational interviewing from series 1. You may want to use that decisional balance matrix. You may want to use pros and cons list to really narrow it down. while we're on the topic of stages of change, does anybody remember any of the stages of change that we talked about during series 1? Anybody recall stages of change? Does that sound familiar at all? How do we know if somebody is ready to actually follow through on this solution? We may choose, the best solution in the whole world, but how might we know if they are ready to actually go through with it and actually make a change? Anybody remember any stages of change? Okay, if not, this is a good place in the problem solving list or the problem solving steps to think about stages of change. Are they in pre-contemplation mode? Have they not even thought about making a change, or has that not even occurred to them? If they're in contemplation stage, they're actively thinking about it, they acknowledge the issue and they want to work on it, but they haven't taken any action yet. Preparation is that stage where you're buying gym clothes, you're getting a subscription to the gym, you're buying cookbooks, you're getting more healthy recipes. That is preparation, getting ready to make a change, but maybe not actually going to the gym yet, or maybe not actually cooking those healthy recipes. Action is when you're doing it, you're going to the gym, you're cooking those healthy recipes from your cookbook. Maintenance means you're doing it for an extended period of time and you're seeing that progress over weeks and months. And then relapse, you may want to give some psychoeducation onto your client that relapse is part of change, that sometimes we cannot sustain change for a long period of time, and that it's normal. Oh, here's some in the chat. I'm sorry. I wasn't looking at the chat. Contemplation. Yep. Pre-contemplation, relapse. Very good. Maintenance. Excellent. Yeah. So normalizing that relapse is part of change, and that it's okay. You'll just come back to the problem solving steps again and try a different solution, or you'll come back and try something different and just normalize that relapse as part of it. Okay, great. Just wanted to reference back to series 1 there for a second. So step 4 is actually implementing the solution. You've narrowed it down, you've picked your solution. We're going to help your client follow through with what you have chosen as the best solution. Best to think of how and when it will be implemented. And this is where the client may really rely on you to put that plan into place, to write those appointments on the calendar, to get those phone numbers of who they need to call to get transportation, to make a list, make a plan, make a schedule. This is really where TBSs can be really helpful when it comes to implementing the solution. If they don't really have that support, you guys know how hard it is to change. I know how hard it is to change myself. If we don't have those plans in place, if we don't have the information that we need, solutions that are difficult may just be avoided altogether, or they can be forgotten when the time comes. I think this is why New Year's resolutions do not work, because people just say, oh, I'm going to lose 20 pounds, but no plan at all on how they're going to do it, what they need to eat, how they need to exercise, so on and so forth. So to me, this really reminds me of like coming up with a New Year's solution and following through and making the plan to be successful. So asking your client questions like, when are they going to start this? Is this today? Is this next week? When is this starting? How will they remember? Do we need to put it on the calendar, set an alarm on their phone, hang up a sign in their room? How are they going to remember to follow through with it? Do they need an accountability partner? Are you that accountability person for them? How will they know when to use their solution? If we are looking at sleep hygiene, do we need to put it on the calendar? 8 o'clock, turn off all electronics. 8:15, take a warm bath. 8:30, write in the journal. So how are they going to know what are the cues to implement their solution? And then very specific steps, like I just listed, if we're talking about sleep hygiene, for example, you'll notice drinking a bottle of wine was not listed in there, but what are the specific steps that they will take to implement their solution? Writing it down, making a list, a checklist even is a great way to help that solution come to fruition. If it takes a lot of time or effort to implement this solution, please consider breaking it down into smaller steps, or having your client figure out how they're going to break it down into smaller steps. I love this little graphic here that says, how do you eat an elephant? You eat it one bite at a time. There's no other way really to eat an elephant. Same thing with tackling a very complicated or overwhelming solution. Much easier to follow through with several smaller tasks versus one giant task. So what does that look like for your client? Outline it, write it down. in whatever way makes sense for your client. So I did want to have a little discussion here and see if you're probably already doing this, but I'd love to hear from you. What are some big steps that could be broken down into bite-sized pieces that may be easier for a client to manage as they are implementing a larger solution? What would make sense as smaller steps towards a bigger goal? You can either unmute and just go ahead and share, or if you want to put it in the chat, that's fine too.
Client who's trying to stop cooking. And we went down to 1 pack a day, it's 2. And every month we're trying to like eliminate cigarettes in each pack. So I'm like, okay, well, if you're gonna smoke 3 today, why don't we just do 2? Sometimes, you know, the nicotine gets people, but we're trying to like wean him slowly off. He does have bad days, and I do remind him like it's okay to have setbacks, but
Absolutely.
that's something that I'm doing.
Great. I love that. Yeah, even counting the number of cigarettes and then positively reinforcing it. You know, great job. Only smoking 5 cigarettes yesterday. You know, I see you're reducing the number. You can definitely positively reinforce that for sure. Love it. Any other big steps that we could break down to help a client achieve an overall goal, especially like vague goals, like I want to sleep better, I want to feel better. How could we break that down? Okay, Kristen in the chat, getting someone out of their room to do an activity, start by getting them in the wheelchair, getting them out in the hallway, making steps to get to the activities. Okay, so yeah, it's almost like when we were talking about in series 1, breaking things down and doing a task analysis. That almost sounds like a task analysis to me. Yep. Stop a habit 1 day at a time. Okay, yep, love that. Love that. So just focusing on what you're doing today. Don't think about, you know, tomorrow, the next day. It's written on the calendar. We'll worry about that tomorrow. Tracking, Jessica says, so exactly how much sleep are you getting? What exactly are you eating? How much are you exercising to, again, reinforce progress? And then if there is setbacks, you know, what is the barrier? What was going on? Okay, great. You guys all have great ideas. I love it. Sounds like you're already doing this in certain ways. Okay, so step 5 is to review. We always want to learn from our past, take that information to be more successful in the future. So after they have implemented that solution, what worked and what didn't? Maybe the plan was too overwhelming. Maybe it wasn't specific enough. We need to make it more specific. Even if the problem was a one-time situation, there's often broader lessons that can be learned and applied to other situations in your client's life. So don't be afraid to use other examples in their life as they're working towards their goals, that they could take that information from and improve going forward. Have the client reflect on their problem and how they handled it. You know, what went well, what did they do as we broke up that step? Maybe they were really good at the exercise piece of it, but struggled with the diet. Okay, well, let's positively reinforce the exercising that they did, and then we'll tackle, maybe we need to break down the diet a little bit more. Maybe we need to get more support. So even if the problem was not solved, which it not always will be solved, I feel like there's always much to be learned that can be applied going forward. So really important to identify even small successes. You know, you quit smoking for 3 days. I think the average person quit smoking like 7 times. So that's normal. Let's keep going. Let's come up with another plan. Let's learn from that, and let's go forward working on that goal if that's what they still want to work on. So take some time to reflect. Ask your questions like, ask your client questions like, in what ways was their solution effective? In what ways was it not effective? If they could go back in time, what would they do differently? How would they change about how they handled the problem? This is a really great question. This last one, oftentimes asking your client to give advice to somebody else who was dealing with the same problem is a great way for them to learn from what they did themselves. So, you know, you tried quitting smoking, you succeeded in some ways you were not successful. What would you advise somebody else do if they were trying to quit smoking? You can get quite a bit of good information from what they say to somebody else that they may not say to themselves, because sometimes we're harder on ourselves than we are on other people. So yeah, looking towards the future, learning about the past is really what step 5 is all about. So let me, 1 second, let me pull up the problem solving example so you can see the completed worksheet, what that may look like once you have completed 1 through 5 with your client. Give me just 1 second. Boop-a-doop-a-doo. There it is. You can see this. I'll make it a little bigger. And I'm using the example here of sleeping, of having trouble sleeping. So what might it look like to go through all of the steps of trying to increase sleep hygiene, improve sleep, what that would look like in a handout. Let me just share my screen again. So here's a completed one. So being specific about what the problem, when and where does the problem occur of feeling sleepy? It's after lunch until dinner time in my room. So that's when and where. We brainstormed all of the potential problems. Remember, not ruling out. No right or wrong. Could be a side effect of my medication. Could also be I'm depressed. I'm exhausted from feeling anxious. I might also have a medical issue. Then helping the client to clearly define the problem. Even more, usually right after lunch, I am so tired and I just want to nap. I can barely stay awake. It's so hard to sleep with nurses and other staff coming in and out of my room. Also, my roommate usually has the TV volume up very loud every day in the afternoon. I'm so irritated and also sleepy. I dread this part of the day and I don't know what to do. So we got even more information about what is going on around them and how are they feeling in that step. So multiple solutions. Remember, there's no right or wrong. Ask my doctor about taking medication at night. Ask my doctor if I can switch to a different medication that will make me so drowsy. Try to get better sleep at night so I'm not so tired during the day. Ask my roommate if she can use headphones when she watches TV, or ask if she can turn down the volume and use closed captions. I could get earplugs or headphones to wear at night when I nap. They might also throw in, drink a bottle of wine before I go to bed here. Remember, no right or wrong. Then we're going to look at each solution. I'm not going to read them all to you, but let's just do the first one as far as strengths and weaknesses. So the first solution was take medication at night. The strength is that it would make them drowsy before bed, probably. If it's making them drowsy in the morning, probably would make them drowsy at night. But a weakness is the client is unsure if the meds will work as well if they're taken at night. So it sounds like this person needs to ask this question of their doctor, which is hopefully probably part of their plan. So here is the solution that they came up with, even including a schedule or a specific plan for the solution. So I can ask my doctor questions about my medication when I see them again, specifically when, next Thursday at 3. How will they remember to do this? They're putting a reminder on their calendar, making a list of their questions. How will they know when to use this solution? She's saying, I'm willing to try taking my medication at night or try new meds to see if I feel less drowsy during the day. Specific steps, again, this is where you come in, reminding your client to ask their doctor questions about meds, explain how they're feeling drowsy during the day, talk about how they can sleep better at night, so improving sleep hygiene. Also involving the roommates, see if they can wear headphones, turn down the volume, be more quiet in general. And then after the person has done this, after they've talked to their doctor, after they've talked to their roommate, after they've tried to improve their sleep hygiene, in what ways, looking back in the past, in what ways was their solution effective? This client says, taking my medication at night has helped me sleep better at night and feel less drowsy during the day. I don't feel like I need to nap as often and I'm less irritated by my surroundings. But maybe it wasn't 100% effective. In what ways was it not? Sometimes I'm still drowsy during the day. Sometimes my roommate forgets to turn the volume down on her TV or use her earphones. Nurses and other staff still need to come in and out of my room during the day to do their job. What would they give as advice, or what would they do differently if they could go back in time? I would have talked to my doctor and roommate earlier. So that's what they learned from this problem solving step by step with their TBS. And then advice they could give to somebody else: speak up for yourself, communicate your needs to those who can help you. It can't hurt to ask for help. So that's kind of what they learned. as well as what they would give as advice to somebody else going through the same same situation. So what do you guys think about that? Any feedback about that worksheet, that handout? Is it feasible? How might you approach it with your clients? Just any feedback in general before we go on. So we're gonna really switch topics here. Want to make sure that we've covered any questions before we go on to a completely brand new topic. Everybody's good? Okay. All right. Well, I can't wait to read your notes, and Stacy, read your notes to see how your problem solving goes. So also related to advocacy, I just wanted to share a resource. It is the Area Agencies on Aging. There is a handout that we provided to you, handout 3.7.2, that shows more information just about what Area Agencies on Aging are. So please reference that. This is a nice little summary. What it is the Ohio Department of Aging provides funding to 12 area agencies throughout Ohio. It's a mix of federal, state, local, community funds. So you may be using this, especially with your clients who are older, to advocate for them to receive services through area agencies on aging, or they may be self-advocating for themselves for needed supports. Best thing to do is to either call and see what supports are available or check out their website on agingohio.gov. And please also see that handout that was provided before class for even more information on this particular resource. Has anybody ever used area agencies on aging to support their client, or has received information or any kind of positive interactions with area agencies on aging? If you haven't heard of it, that's fine. That's why I'm telling you about it today. Oh, we got something in the chat. Samantha has. Okay, great. Awesome. Just last week, I personally went to a 2-day conference that was sponsored by an area agency on aging in Cincinnati, and it was very helpful to hear the trainers and to network with other long-term care facilities to find out how they use our services and to provide information to them about ViaQuest. So I found it helpful not only for the trainings, but also as a networking opportunity myself. So they do offer not just supports to the aging population, but also to those who provide supports to that population. So please check out their website if you're at all interested to see what might be available to you to get more training for yourself or services for your client as well. Okay. So we're going to review one more time I statements, and this is just going to be a review because we did go quite in depth in series 1 about I statements, but we did want to provide some new examples for you to use with your clients, some new ways to think about I statements that maybe we didn't cover in series 1. So it is the same topic, but maybe approached in a little bit of a different way. So this is handout 3.7.3 and handout, excuse me, 3.7.4, excuse me, is going to detail I statements as well as go over communication, such as passive, aggressive, and assertive communication, reflections, and other communication tips. So just so you know, we will go into more detail about these different types of communication, passive, aggressive, assertive communications here in a moment. So you would use this handout as an example on how to provide psychoeducation for your client. So this is used for a variety of purposes. It could be used for psychoeducation. It could also be used to teach skills. So both of those handouts, 3.7.3 and 3.7.4 are great for you, for your own information, as well as to use with your clients. So just to kind of quickly, we'll go over what is in those handouts as far as what are the differences between those types of communication, passive, aggressive, and assertive. There are distinct differences that you will see here in a second. Passive communication is when a person prioritizes others, even at their own expense. A person who uses passive communication does not express their own needs. They're not self-advocating. They're not standing up for what they want and for what they prefer. They're deferring to others. So this can lead, unfortunately, to clients being taken advantage of even by well-meaning people who are just aware, or who are just unaware that this person's style of communication is passive. So you can kind of see here in this little cartoon on the screen that the person who has passive communication is just saying things like, fine, whatever, I don't care, because they're deferring to what the other person wants, what the other person is communicating. So that is passive. What it looks like to see it in real life is people who are soft-spoken, quiet, allow others sometimes to take advantage or monopolize the conversation. Again, prioritizing the needs of others, don't have good eye contact or looking away, don't express their own needs or wants, and just kind of in general, don't have confidence. But I do kind of want to differentiate that there is a difference between, for example, like you see in the picture here, actually having a preference for Arby's versus Wendy's and not communicating it, and just really honestly not caring. Like, it really doesn't matter to me whether we go to Arby's or Wendy's. Somebody who has passive communication really wants to go to Arby's, but is afraid to speak up, or is afraid to say that because the other person wants to go somewhere else. So that very quickly is passive communication. On the other hand, aggressive communication is really the opposite, I would say. People who have aggressive communication might look like they're easily frustrated, loud, overbearing, not willing to compromise, lots of criticism, humiliation, interrupting others frequently, disrespectful towards others. They expect others to do as they wish and to be compliant with them, with no discussion, without putting up any kind of fight. So that is the hallmark of aggressive communication. Other things that describe aggressive communication is a person only expressing that their needs and wants, their perspective matters. The other person may be bullied or even ignored. Usually it is easy to identify these people as they do not really try to hide it. And it is hard to hide an aggressive communication style. So as far as working with your clients, what you want to be teaching them is to not be passive, to also not be aggressive, but to kind of be in the middle. And you'll see the Venn diagram here in the middle has assertive, which is where you are being aware that your needs and wants are important and the other person's needs and wants are important. You're trying to find a compromise. People who communicate in this way are confident when they are communicating assertively. So what that looks like is a assertive person communicates without interrupting, clearly states what they want or need. They are willing to compromise. They stand up for their own rights. They have confident body language, confident tone. They have good eye contact. Really, they're respecting the other's needs and wants while also communicating their own. So just like you have already been practicing I statements with your client, you may want to take it a step further. Once they're really good with I statements, they may be ready for a next step of learning to use assertive communication as they are self-advocating. So the handout that we provided has lots of good examples that you may want to role play or practice with your client. Here is just one example. A scenario is a friend asks to borrow your phone for a day. This will be a big inconvenience for you. So a passive response would be, yeah, I guess. Do you need me to dial the numbers for you too? That's a little passive aggressive, I would say. Aggressive is just outright, no way. Why would I let you borrow my phone? You're crazy to even ask. A balance between the two is asserting, I need my phone today, but you can use the phone in the common room. So that's kind of a compromise, still standing up for what you need and want, but noticing that the person needs to use the phone. How can I help them? They can use the phone in the common room. So just like you guys have gotten good at I statements, it's going to take practice to also get good at becoming more assertive. So in this handout, we provided, I think, some better examples that may fit some things that your clients are experiencing. So this would be a great way to role play with your clients. Let's just do one, and let's do it in the chat, or if you want to speak up and unmute and share, that's fine too. Let's try the second one. So the scenario is that your client's roommate left a mess and your client is too busy to clean. What are some passive statements you could help your client come up with? What might be an aggressive statement your client may say in response to that? But what ultimately would be an assertive statement? in response to that scenario. You can either unmute and share, or if you want to put it in the chat. I'm looking for all three: a passive, an aggressive, and an assertive statement to that. Because this is a big part of advocacy, being assertive. Okay, great. Someone in the chat already. Somebody types very quickly. Kirsten says, I don't know why you are so busy to clean all day. All you do is lay in the bed all day. Okay, that sounds kind of aggressive. Okay, Andrew has, I would appreciate you cleaning up your mess. Okay, is that assertive, Andrew? Is that aggressive, or is that passive? Assertive. Okay, yep, stating what you need. Love it. In a respective way. Okay. All right, I'll leave a few minutes for a couple more. I think we just have one more handout to go over. You guys are probably furiously typing over there, I'm sure of it. Okay, Jessica has a passive statement. I'll make time to clean it up, even though I didn't make the mess. Okay. Yeah, so really not respecting your own needs, but just catering to the other person's needs. Got it. That is quite passive. Let's get two more. Anybody else? It's easy, that's why we're practicing. Okay. Sonica gave us an aggressive one. Clean up your mess right now. Okay. Yep, that's quite demanding. That's aggressive, not taking into consideration the other person. Okay. Sometimes once you are good at doing the aggressive and the passive ones, it kind of becomes clear what would be the assertive statement. Okay, Jessica, assertive. I can make a cleaning chart and both of us can have specific cleaning days. Okay, great. Yeah, noticing what I need, recognizing what the other person needs as far as their time. Okay. I'm tired of cleaning your mess for you all the time. Next time I need you to do it. Okay. All right, great. Thank you guys. I know it does take practice and I did spring it on you. So be good at this yourself before you start, role playing and practicing this with your client. But we have several handouts that sort of walk you through again, as well as a PowerPoint. What is assertive, what is aggressive, what is passive, and then you should be ready to practice and role play with your client. So we do have one more resource to support your client in self-advocacy, and that is called Emotional First Aid. This is handout 3.7.6. Excuse me, it's actually an entire book. If you're interested in reading the entire book, titled Emotional First Aid by Guy Winch, PhD. I'm just going to boil down the most important steps that you can support your client as far as self-advocacy when it comes to emotional first aid. But please, if you are interested, check out the book. But what this book outlines is that there are 3 crises as far as emotional first aid that we may need to tend to, as far as rejection, loneliness, low self-esteem, brooding, guilt, failure, and loss or trauma. So just like we learn how to respond to first aid, you know, if somebody cuts themselves or if we need to do CPR, emotional first aid is the kind of same idea that a person can learn themselves how to respond, maybe once treatment is over, or maybe once they move out of that facility and some other facility, what they've learned with you, to kind of apply emotional first aid to help themselves. And this may be especially helpful as you're nearing discharge with a client to kind of prepare them almost to be their own TBS or to be their own therapist. So let me just pull that up real quick and we'll take a look at what this looks like. And I'll just give you one of the examples here across the screen, and then you can check out the other ones after class. Make this a little bit bigger. Oh, well, that's too big. There we go. Okay, let's see. Let's try low self-esteem. Let's just look at that one straight across. That would be the emotional first aid that we're tending to. Thinking of it using that medical model as somebody having a weak immune system. So thoughts like, I don't deserve this, everything about me is so wrong, I'm weak, a loser and stupid. You might also hear maybe your client saying things like, I'm never going to make progress to get out of here. Things like that may reflect low self-esteem. But the first aid tips to increase self-esteem that are listed here are things like writing a cheerful letter for yourself as if you were writing it to your friend. Again, we are often much kinder to other people than we are to ourselves. So sometimes having your client take the perspective of somebody else, writing a note to themselves as if they were somebody else about what are their strengths. What are some positive affirmations? What are some good things? May help them to get a little distance and help build their self-esteem. Other tips here are remind yourself of all the great things you have done. So you can also support your client to come up with that list, help them build it, maybe several sessions that you could take to do this over time to build that list up nice and long, almost like emotional first aid is what we're talking about here. So there's other tips, there's other suggestions for other issues that your person may be working on in treatment with you. I'll let you look at those on your own time, but I did want to introduce you to the book and to that infographic that is handout 3.7.6 that you could use in session with your client. Okay, just a couple minutes left. Want to make sure we get to documentation. So if you were working on advocacy with your client during session, you choose that as the intervention. In this example, the activity is developing, practicing self-advocacy skills, things like problem solving that we learned today, either modeling them or demonstrating them while the client practices them. Tell me if you think this client response meets medical necessity. At the beginning of session with this writer, Betty stated, quote, I've been so lonely lately. My sister never comes to see me. She's tired of listening to my problems. Betty was assisted in filling out a problem-solving worksheet and stated her problem was, quote, I don't talk to anyone except my sister and she hasn't come to visit me. After discussion, Betty identified establishing new friendships with peers as the best solution to her problem. Betty stated she would spend her afternoons in the TV room to spend time with her peers. So what are your thoughts? Does this meet medical necessity? Yes or no? Why or why not? What do you think? Would you write it up differently? Would you add different details? Would you leave certain things out? Oh, we got something in the chat. Got a couple things in the chat. Does it mention mental health or how many times? Does it mention diagnosis? Yes, I don't think I see anywhere here. Lonely, okay, but we need a little bit more. What does that look like? What is the loneliness? Is there a diagnosis? How is that affecting her functioning? We need a little bit more detail. Okay, I would agree with that. We need a little bit more information about the diagnosis, a little more about symptoms. That I think is what's missing. We do have client quotes, so this is person-centered, so that's a good thing. We have the client name. So there are some good things about this, but it could be a little better, I would agree, by having diagnosis. Let's do the same thing with the plan. This example plan is Betty will spend the afternoon in the TV room instead of her bedroom 3 times this week, and we'll discuss the outcome at her next session. What do you think? Could this be more specific? Could this show medical necessity more clearly? If so, what do you think about that? Would you state the plan differently if this was your client? Oh, something in the chat. What the goal of her spending time in the TV room will accomplish. Okay, yeah, so how is that going to decrease her symptoms, and what symptoms are we decreasing? Yeah, so for what reason, I think is kind of what you're saying. For what reason is Betty spending the afternoon in the TV room instead of in her bedroom? Okay, yes, a little bit more about the end result, you know, to decrease depression, to decrease anxiety, to decrease feelings of loneliness. And then the last input I'll give you is from Brittany. It's okay, but the bare minimum, yeah, I would say over the next week, because someone could think her next session could be 2 months from now. Yes, yeah, so more of a time frame, exactly. That could help be more specific. Very good. Okay. All right, so any questions about advocacy? Any questions about self-advocacy, what you're gonna do this week with your clients? I can stay on for a few minutes. I know it's 5 o'clock. So if you need to stay on after, that's fine too, but any immediate questions, concerns? Everybody good? Everybody know what you're gonna do? Okay, if you run into any issues, don't hesitate to email me or Stacy. We'll help you out throughout the week. Otherwise, I hope you guys have a great week, and thanks for participating today. You guys had a lot of great ideas. I can tell you're already doing a lot of this. I just challenge you to maybe start doing self-advocacy and advocacy in different ways over the next week. And I will see you guys next Tuesday.
Bye. Have a good week.
All right, thanks.